an injury is not the end and that there is a way to come back from it. And we saw a gap in people's knowledge in that they didn't understand what rehabilitation was.
We have a passion to help people.
To get you back to a normal and pain-free life.
My Movement Therapy is the center. We started it, why? Because we have a passion to help people.
And we saw a gap in people's knowledge in that they didn't understand what rehabilitation was.
Yeah.
Fear is a huge factor in a lot of people, and we want them to understand that they don't need to be fearful.
And there's a poor relationship between therapists and patients. There's no communication. We saw that breakdown completely.
Yeah, so our goal is to fill that missing gap so that people can understand that an injury is not the end and that there is a way to come back from it.
Yeah.
And that it doesn't always have to be scary. If you find a good therapist that you can work with and you work as a team to get you back to a normal and pain-free life. And let's also discuss why we called ourselves My Movement Therapy. And that's because we have an emphasis on movement as a key factor or a key part of the rehab process, because it shouldn't only be manual therapy.
Yeah.
That's one step in the process.
Exactly.
So we can't use manual therapy as your only tool to rehab someone back to I don't know, normal, I suppose, or back to where they were pre-injury.
After doing the process of movement therapy, actually become a stronger person than they would have been.
Well, yeah, it makes sense because you get better awareness once you understand how your muscles work, and once you gain better awareness with therapy, with movement, and that comes back again to the educational side of it. The education is a massive part of our rehab approach, because we want people to understand why we are doing what we're doing, and then also giving them that guideline into returning back to movement. And we're trying to find that link between just the manual therapy and versus just loading someone. There has to be a gradual progression from getting pain-free or desensitizing someone who's in pain and then getting them back to movement. And I guess that's why we work well as a team, because your job is the initial approach in helping people back to a pain-free state, and for them understanding that it's safe to gradually progress to movement. And that's where I take over from you and get them back to moving again, get them stronger so that we don't have this constant return back to pain or discomfort or re-injury. We want them to get, as you said, back to normal and then even stronger than before. I always say to my patients afterwards, I hope I never see you again.
Yeah.
Because if I don't see them again, I've technically done my job.
Yeah.
Okay, so let's talk about what rehab is, the whole scheme of rehab, because it entails so many disciplines. Because I often get the question from people asking, should I go see an osteo? Should I see a chiropractor? Should I see a physio? Should I see a PT? Should I see a movement therapist? Should I see a biokineticist? There's so many different
aspects.
So many different aspects, or so many different scopes of something which actually should all fall into one kind of field. It all falls under rehab.
Yeah.
All these people are involved in the rehab process. If you have a good therapist, they should cover all those components.
Exactly.
And if you go to a good therapist who is out of their scope of practice, they would be able to refer you on to someone who's maybe better suited for your case.
Yeah.
It's more like this, one's not better than the other. You can't say an osteo is better than a physio versus a chiro versus, it goes person to person.
It's a combination of therapy. You can't just have someone manipulating you all the time.
I think you can have maintenance work done where you get in some dry needling or some sort of manual therapy or whatever the case may be, once a week, once every 2 weeks, whatever the case may be. But I think the argument on the other side is that shouldn't be your go-to if you're getting the same pain returning on a weekly basis or a monthly basis, because then you're not solving the problem of the issue.
Yeah. And people are too lazy to solve the problem.
Yeah.
A lot of the time.
But it's people who are lazy, the client, and it's sometimes also the therapist who's lazy and not willing to do the work to dig and find out what is the cause or what's the root issue. Why is this person still in pain? because their job, along with the patient, is to find out why they're constantly getting the same sort of pain.
Yeah.
And if they can't figure it out, then maybe that's when they can refer it out to someone who's more suited. Maybe a chiropractor is more suited to that individual, maybe an osteo is more suited. So like you said earlier, it's case to case and person to person.
Yeah.
On what type of therapist that is best for an individual.
And even between me and you, we have differences in our treatments where you're more movement based and I'm more manual therapy based. And I like the way you treat a lot.
When someone gets relief from a treatment plan that you've given them before, they become confident in that treatment plan, they become reliant on that treatment plan. People sometimes misinterpret what physiotherapy is, and they sometimes think it is massage or dry needling and it's just being on the bed, when that's not the case, because a good physiotherapist should be getting someone back to moving and eventually loading them, because that's how the body's going to adapt and how it's going to change and get stronger. And it doesn't mean you have to load them with heavy weight. You can load them in with deep range of motion, or it could be mobility exercises. That's how you load. And it depends on what the person needs. So it's specific for each individual. And rehab, or rather physio, is not just a form of manual therapy. Physio involves manual therapy, involves corrective movement, it involves loading someone. The funniest thing I get when I'm getting towards the end of a rehab program with someone, they always make this comment. They go, "Oh, so this is like PT. We're just doing PT now." And yeah, that's effectively what it is. If you're running a good rehab program, you get back to doing the same sort of movements which a PT should be doing with their client. It might be some form of squatting or pushing or pulling or hinge movements.
Great technique.
Yeah, I think it starts in the beginning with kind of reinforcing movement patterns and technique, and then you add load, you add weight, because that's how we adapt. I mean, the body's an organism, so if we don't load it or make the movement harder, it plateaus.
And at the end of the day, you're going back and teaching them those basics and then building them back up with that strength to get into their strength training again.
I think to simplify it, when you move from a manual kind of therapy process to a more movement therapy based process, it's just a combination of regressions and progressions.
Yeah.
So can someone do a hip hinge with no pain? So let's if someone's got back pain, can they hinge or do a deadlift movement? If there's still pain there, maybe you have to regress that movement. Maybe you have to start off with learning how to tilt the pelvis into neutral, and you start on the ground and gradually move your way to a deadlift.
And teaching them where neutral is, where an anterior pelvic tilt and where a posterior pelvic tilt is, will then make them become aware of their position in space.
I would say simply what rehab involves is getting someone back to a pain-free state. Okay, with whichever method necessary. So whatever tools you use, and everyone has their own method of treating. It might be through ultrasound, it might be through dry needling, it might be through using Graston, whatever the case may be. Getting someone back to a pain-free state so that they're comfortable to move again, and then gradually loading them and making those movements more and more challenging until they've got to the point where they are at a level they used to be at, and then progressing them past that. So hopefully they don't get re-injured again.
Exactly.
I think that's the simplest way to describe what we are trying to do when we're doing rehab.
Yeah.
Voila.
Khalas.